Good afternoon, and welcome to today's panel on pregnancy and parenting in a pandemic. This is hosted by Tallahassee Memorial Healthcare, and we thank you all for joining us for this year's Baby and Family Fair virtual series. We look forward to sharing what we learned from the past year and where we go from here. I'm Amy Kimmel, and I will be your moderator today. I've been a birth doula and childbirth educator for about 10 years in Tallahassee, and I'm also a mom of 3, one of which I welcomed during the summer, during pandemic peak. So first, let me introduce our panel. Join me in welcoming Dr. Clayton, Dr. Katherine Clayton. She's a pediatrician at TMH and cares for both children admitted to TMH's Children's Center and also to newborns in the postpartum family care unit. We are also joined today by Dr. Jana Bures-Forsthoefel and Dr. Dorothy White. They're both OBGYNs at Gynecology and Obstetrics Associates of Tallahassee. They care for women through every stage of life, as well as deliver babies in TMH's Women's Pavilion. And we're hoping that Dr. White can stick with us the whole time. She is on call today. So finally, please join me in welcoming certified nurse midwife Darcy Ward to the panel. Darcy works at TMH's Anderson Brickler Midwifery, caring for moms before, during, and after pregnancy. You can also find her in TMH's labor and delivery unit, delivering babies and caring for the moms in triage. So thank you so much for joining us today. One more piece of housekeeping before we get started. Many of you have submitted questions ahead of time, and I'll be delivering those to our wonderful panelists. If you have additional questions that you think of while you're watching, go ahead and use the Q&A feature here in Zoom to submit them. We will check those as they come through, and we'll get to as many as we can with our experts in real time. So without further ado, let's get started. My first question I'm going to give to Dr. Forsthoefel. So just over a year ago, we knew very little about COVID-19, including what the virus and the pandemic would mean for pregnant women. What do we know now?
Well, it's been a year of HELL, has been one thing we recognize, but we have come a long way in terms of the fear factor. We are less fearful now because we are much more knowledgeable about the virus and what it does. And pregnant women, I think, are also less fearful because they are seeing that babies are being born and doing well. Moms are doing well. Unfortunately, in the big scheme of things, the big message that we need to send to moms is that mothers that are infected with COVID-19 have a much greater risk of compromise than the general population. So our moms need to be very, very careful of being exposed, and once exposed, our concern level is much higher for these pregnant women than in the general population. So if anything, the message is today is that our pregnant women need to be very, very cautious of the exposure. So they need to be wearing their masks, they need to be doing their distancing, they need to be doing all the right things to avoid getting infected. But also they really need to be open-minded to getting the vaccine so that they don't contract the virus.
Mm-hmm. So can COVID-19 be passed from moms to their unborn babies?
There's been case studies of babies being born positive for COVID, whether it's a vertical transmission from the mother during her pregnancy or a contact after the birth is not always clear. But if they do contract the virus, these babies do very well. Children and newborns do not seem to become as ill. It seems to be a very low-grade viral respiratory illness, and they tend to do very nicely. So it's not as big a concern because the mother passes immunity through her system, through the placenta to the baby. So even if they do get it, they tend to do very well with it.
So they could pass the virus, but also more importantly, they could pass the antibodies to baby.
Yes, there have been babies born with positive antibodies already at the time of birth, yes.
And then can a mom with COVID-19 safely breastfeed her baby?
Yes, they highly encourage that these mothers do breastfeed because the benefits of breastfeeding far, far outweigh the risks to the baby should that baby contract COVID. That baby's probably going to do very well, even if it does get that COVID vaccine. But breastfeeding is so important for moms to do because of the immunity, for many other things, not just to COVID. And the mortality rate of babies not breastfeeding is much higher than the mortality rate of babies being breastfed. So when you do the risk-benefit ratio, moms are going to do much better, babies are going to do much better if they're breastfed than avoiding breastfeeding and if you're COVID.
Mm-hmm.
So breastfeed, breastfeed, breastfeed. Right, Dr. Clayton?
Yes.
She agrees.
So, Dr. Wright, she mentioned the vaccinations. Of course, vaccines have been a hot topic for the entire community, but especially for pregnant and breastfeeding people in the community. There's some fear that the COVID-19 vaccine will affect pregnancies negatively, cause infertility somehow, or taint breast milk. How do you navigate that with your patients and reassure them if they're feeling hesitant?
Well, one thing is, for the first time now, we have published data in the New England Journal of Medicine for the first time last month. Over 35,000 pregnant women who've received either one of the mRNA vaccines and have done well. No evidence of any increase risk or pose any increased risk to the mother or baby for pregnant women that decide to get vaccinated. The other thing is that ACOG and the CDC recommend that pregnant and lactating women both are offered and get the vaccine just as non-pregnant and non-lactating women would. So that recommendation was already there before the reassuring data that's the preliminary starting to come out now because women are starting to receive the vaccine. So just like Dr. Forsthoefel was saying, the fear and these vaccines now being available to pregnant and breastfeeding women has really changed that. As much of the fear, where a lot of people were delaying conception and delaying conceiving last year, or even trying to conceive, and we see a lot of women getting vaccinated and then feeling more comfortable conceiving and starting to try to conceive again, which is great.
Oh yeah. Can vaccinated women pass the antibodies to their baby? I'm particularly curious because I just finished my second dose. So
yeah, great, good for you. And you're breastfeeding?
Yes.
Good, perfect. So yes, just like pregnant women should be offered the vaccine and have the ability to get the vaccine, you don't even have to have a doctor's note. If you want to have a discussion with your doctor before you get vaccinated, you can, of course, if there's hesitancy or you have questions. But you don't have to have a doctor's note to go get the vaccine, whether you're pregnant or breastfeeding. Unlike being pregnant, we're not for sure about the relaying the immunity to the baby yet in utero. There's actually pretty good evidence that there's antibodies in your breast milk when you get the vaccine. Within 6 weeks of getting the vaccine, that you have antibodies available in the breast milk to your baby. So we're recommending that if women don't feel comfortable, since it is their choice, if they want to get vaccinated while they're pregnant, we know it's their choice. If they choose to get vaccinated while they're pregnant because they're hesitant, then we do recommend that they strongly consider it while they're breastfeeding.
A follow-up to that, the complications that you mentioned previously, Dr. Forsthoefel, were of unvaccinated women who are pregnant, or is that also including vaccinated mothers as well?
Well, our vaccinated mothers are not coming down with COVID in general. We've not seen that, but it's our unvaccinated moms that were coming in prior to the vaccine that were coming in. And for every symptom and complication of COVID that you see in patients, it's much, much worse in the pregnant woman. And morbidity, mortality, and pregnancy with COVID is very, very much more concerning than in the non-pregnant women of equal age and morbidity. So get your vaccine, please.
Yes. All right, so changing gears a little, Darcy, this has been an incredibly stressful time for a lot of people. Have you seen any effects of this constant state of stress on women's pregnancies?
I mean, of course. I think everyone has had a really, really hard time, and pregnancy and birth and the postpartum period are already stressful for people. So it tends to be a time of sometimes great happiness, but always a lot of change. And so throwing COVID on top of that, I think has been really, really challenging. And they have been able to do some research on it. They've found that, let's see, a bunch of women in Brigham and Women's Hospital in Boston were surveyed, and they found a much higher number of them had depression and anxiety and even post-traumatic stress disorder than they did prior to the pandemic. So it's increasing all of those things. And it's important to mention that that study was conducted in women who were mostly white, partnered, upper middle class, and those like the anxiety, depression, PTSD are all higher in people of color as well. And we know the effects of COVID have been disproportionately in communities of color, and so I think the stress is true of everybody, but particularly for certain folks. And another thing to know about this is that intimate partner violence has gone up during COVID as well. And so that's, of course, an incredibly stressful thing. And sadly, it does also go up in pregnancy at baseline. And so adding COVID on top of that is really asking a lot of a lot of people. And even if there's absolutely nothing else going on in your life, than just concerns about yourself or your family catching COVID, maybe grieving lost loved ones who have died and not been able to celebrate their life or had any milestones in the last year, changes in childcare arrangements, and then in vaccines, so all the stress over knowing what to do and how best to take care of yourself and your other kids. I think all of it has been really hard for people, and it's taking a toll on people's mental health.
Just, can I add something to that?
Yeah.
Just the prenatal care, because of all the restrictions in the hospital and the restrictions in our offices, women are coming in without their partners, women can't bring their children with them. That's stressful in terms of childcare and whatever. And then when they come into labor and delivery, the restrictions on who can be with them and how and whether they can go back and forth. They're lightening up now, especially with the face of vaccines, making it a little bit easier, but it's still very restrictive. And that's very stressful. If you can't have your partners with you or the people that your support systems with you, that makes it hard on patients just during the labor and delivery process.
Absolutely. I can certainly relate to that. That was a major shift that I saw with my third baby, in that we didn't have the partner support in most visits. I know a lot of practices are now permitting one guest, and that kind of varies practice to practice. So one tip that I found was really helpful was to like sit and kind of make our questions ahead of time, and then make sure that I get all of their questions answered, but also to kind of like text throughout the appointment to kind of make them virtually there. I know some people can do like FaceTime or a phone call, but text always worked for us. So,
and that's something that I think that people don't always think that we'll be okay with as the providers taking care of them. And generally speaking, we're very open to dealing with folks on the phone or FaceTime or text or whoever you want to include in this. The point is not the isolation from the contact, it's the isolation from the germs associated with it.
Right.
And so, you know, if anybody wants to join in virtually, then we're happy to have them.
Yeah. That kind of ties into this question for Dr. Forsthoefel. How has your role as provider changed with some of these additional restrictions, and kind of how has the technology changed with what you're doing?
Well, a lot of the technology in terms of COVID has been rapid testing. So you get your rapid test, and then you're a little more free to be able to do some of the things you need to do. But the rapid technology, there's not really been a whole lot of technology in terms of taking care of patients. It's being able to take care of patients. Can they come in? They have COVID. sometimes they have COVID and then they can't come in because they have to be quarantined for 14 days. So then you're doing online discussions with these patients, or the portal becomes very important for us to be able to talk back and forth. A lot of that has been utilized much more now than ever before because they would just come in and be seen. Now they can't always be coming and be seen for those things. But I'm not so sure that there's much technology other than the testing. Maybe I'm missing the point of the question.
No, that you hit the nail on the head, I think. Being able to communicate with your patients virtually and have virtual appointments, definitely one way to access care. I know Dr. White was mentioning the delay in getting care prenatally, or the delay in the decision to start trying or to undergo fertility treatments. And some of those things can be done virtually so that the technology helps. And then, like you said, testing. I know at the time that I first went in, there was not a readily available COVID test or COVID screening. So that's a huge difference from this time last year. So,
but it's difficult for us to do a lot of virtual.
Yeah,
we can talk to patients, but we really can't examine patients well virtually in our particular field. So
yeah, obstetric care is definitely a very in-person kind of thing. Gotta feel that baby. So, for Darcy, many moms had an idea in their head of what their delivery would be like, and you alluded to this with coming in labor. What is your advice for moms in planning their births now?
Yes. Well, it's the same as any advice we always give, which is have a plan A and then a plan B and C and D. And, because the birth and labor tend to not go as you plan pretty much no matter what. But the COVID does add some unique challenges. And one of them that Dr. Forsthoefel mentioned earlier is the visitor policy. And so on labor and delivery, we're still only allowing one visitor. And that's one visitor that can't switch with other people. So it's not just one at a time, it's one person throughout the delivery and then also the postpartum period.
Mm-hmm.
And so choosing that one person ahead of time is probably a good idea. There's sometimes situations where the mom assumes that they'll be the one that's there, and then they're at the door and feeling hurt. And so knowing ahead of time who your main support person is going to be, and having communicated that to your loved ones is probably a way to ease some of the stress of that. And one major exception to that rule is doulas. And I know Amy can speak to this herself, but the doulas are very, very helpful in any circumstance, but especially with COVID, because they can take on some of the roles of support and be an additional person that you're allowed to have. And so sometimes doulas are a good match for folks who are looking to get a little extra support and can't necessarily get everything they would want from their one person that they're allowed to have. There's oftentimes the guy.
The other thing I've had patients ask is, do they have to wear their masks the whole time they're in labor? It's the ideal, but I would say that the 99% of them don't wear a mask while they're in labor. Maybe their partners are wearing, and certainly we, the staff and the nursing staff, are wearing masks, but the poor lady that's puffing and puffing, we don't make them wear their mask.
That's reassuring to hear. That was my experience. I had a mask on for much of the beginning, but when things got really intense, my partner and the staff all remained masked, but while I was busy pushing out a baby, nobody said, "Hey, can you get your mask on now?" between pushes. So
it's gotten a lot easier to be less restrictive about it now that most of the staff is vaccinated as well.
Yes. I think that's something that a lot of mothers are trying to figure out what to expect. So the current visitor policy allows for doulas and a support person, and then masking is encouraged as much as possible, even in your room. And that I know that's going to be evaluated again soon, and so hopefully whenever that changes, there will be an update really soon. Do you see any silver linings to that single support? I've heard that a lot as a mom. A lot of people said, "Oh, it's a good thing you don't have everyone at your door." Do you see that a lot as a benefit to the patients?
Yes, it really is more intimate. And of course, if you have two people you really love and they're both super supportive, that's not a bonus. But before the pandemic, I think a lot of women felt pressured into having a lot of people in their room, especially people like mother-in-laws or their other folks who really wanted to be there and they felt like they couldn't say no. The hospital saying no for you is sometimes useful a little interpersonally. And it's made the birthing room smaller and more intimate than sometimes the stadium seating option.
The other thing is it's much easier for nursing staff to take care of their patients if they're not
Yeah.
also to take care of A, B, C, D, and F, who have their questions and their issues and whatever. Some of them fainting, children in the room that shouldn't be in a room. That sort of thing.
I think it's also made a big difference in the breastfeeding success because pre-pandemic, I saw a lot of women who had like a revolving door of visitors throughout the day, and they felt uncomfortable or hesitant to breastfeed in front of their grandfather or their brother's friend. And I feel like that's been a lot less significant since we don't allow everyone to come and visit all the time. There's pluses and minuses, obviously, but that's been one bonus, I think, of there not being a humongous number of visitors coming through every room.
Wow, that's fascinating. I would not have thought of that. Well, Dr. Clayton, you were my next person to ask a question for. We've been talking all about pregnancy leading up to the birth. So we're going to shift gears a little. Talk to me now about taking baby home. That was very nerve-wracking for me. Do you have advice for parents taking home a newborn during this unique season of COVID-19?
Yeah, I don't have kids yet, but I see parents every day who are worried. Their main goal is taking care of their babies and they want to keep them safe. And so it's definitely a legitimate worry. I think it's important to remember that babies have always been at higher risk for bacterial and viral infections. So we have always been more guarded about taking care of preventing them from getting infections. And so COVID, is a new virus, but we're still protecting them from all of the viruses that are out there all the time because their immune systems aren't strong yet. So we have to do the distancing and the avoidance to help prevent their exposure to those infectious organisms. So one of the most important things that you can do as a parent is just to avoid situations that your baby is put in that they might be exposed. So you can do this by limiting the number of people that you invite into your home to meet baby until their immune system is stronger. You also want to make sure to wash your hands frequently and ask anyone who takes care of the baby to wash their hands frequently. If you do have visitors, you can ask for them to wear masks to help limit the spread of infectious organisms. And again, like Dr. Forsthoefel said earlier, breastfeeding is going to help provide your baby with great immune proteins to help start building their immune system until their body catches up and is able to do it on their own. And then lastly, babies should never wear masks to protect themselves from infections. So that's a kind of a safety hazard. So that's not a good goal.
Yeah. Interestingly, I want to add, I have several grandchildren here in town, and not a single one of them have come home with a cold or any issues since they started school. Well, with all this mask wearing, even the young children that are wearing masks, that are encouraged to wear masks. So not only is it reducing their risk for COVID, but it seems to be the flu, the cold, they all seem to be doing better. And so are the parents at home because they're not getting sick from their children. So maybe this mask wearing isn't such a terrible thing after all.
Well, that's why we've been so successful with our COVID moms that we had last year, Jana, that were breastfeeding that had COVID, were using these precautions, rooming in, but social distancing, mask wearing, hand washing, putting on a fresh gown before breastfeeding, and then also practicing social distancing with their baby when they weren't actively breastfeeding and wearing a mask when they were. The babies have done great. And it just proves that concept.
I would just add another thing too, that if a mom herself didn't feel comfortable getting vaccinated while she was pregnant or even breastfeeding, then adding in everyone else around the new baby, getting vaccinated for COVID as soon as possible would be another way to protect the baby and encourage your family members or friends to be more health conscious.
Yeah. So similar to the way that we would encourage those caring for baby to get the pertussis or flu shot, we would also say, yeah, it would be a good idea if you could also get the COVID shot. So talking about being around family members and loved ones outside of the home, a lot of family is that support that moms and new family members are relying on when they have a new baby. So without that support, or with kind of reduced contacts, more social distancing, how can parents cope? What's kind of your advice for parent coping with that? I think everyone's probably got thoughts, but I'll toss this to Darcy first.
You're muted.
There we go. It's hard. I think it's just like I said, I think I would encourage anyone around the baby to get vaccinated so that you can feel comfortable reaching out to your support system and getting more of the community support that you'd ordinarily have in regular times, and being able to get outside. So outside is much less risky than being indoors, and it's certainly not cold these days, so you can feel comfortable doing that. And there's several different organizations in town. Amy can speak to this better than we can. Postpartum Support Tallahassee is one of them. And did I say it wrong? Postpartum.
Okay. Postpartum wellness. You're close. They would have found us if they Googled that.
There's a lot of organizations in town that can help with any kind of adjustments, particularly in the postpartum period, but during the whole pregnancy and beyond. The ways to support yourself that you would ordinarily use, I think it's important not to forget about. So things like eating fruits and vegetables and trying to get some sleep, sort of prioritizing that over cleaning, for example, getting any kind of exercise, just little things like that you would ordinarily do to take care of yourself are added into getting through this period.
Yeah. I think
wine helps. What'd you think?
Would you say, Dr.
I
Forsthoefel?
said a glass of wine helps.
Oh.
Put it out there.
I was going to be a little more constructive than that. No, I'm just kidding.
Thanks.
I was going to say, with COVID and during this last year, as we all know, regardless of pregnancy and postpartum, which are high risk timeframes for women for mood disorders and for especially postpartum depression, there's been an overall increase in the population of mood disorders. So we have to recognize that women that are pregnant and or postpartum are at an increased risk of that too, with during this pandemic, of even higher than they normally would be. And I really just encourage women to talk to, seek help. Talk to their doctor about it at their postpartum visit. If it occurs outside of their postpartum visit, don't hesitate to find support systems outside of us. But also, if they want to come back and see us, we would, we encourage the patients to come back and have an additional visit with us, just to talk about that. If it's during their pregnancy, peripartum, postpartum, within the first year after their delivery, any of those timeframes.
Yeah, that emotional and mental wellness is always important, but you're right, during this time especially, it's especially important to focus on.
So, I would add too that in triage is always an appropriate place to go during the pregnancy, and then for 6 weeks postpartum. The midwives of the family practice residency are always there. And so that can be at least a jumping off point for people who feel like they're in crisis, or even if things are just really hard. In general, actually, anything you're super, super stressed about, even if you're not sure it's an emergency, we're happy to see you. We're open 24/7. We can deal with whatever is going on and at least be the bridge to getting other kinds of care if you need it. And one of the perks, the silver linings, I guess, about the pandemic care is the advent of telehealth for mental health services. And so a lot of times you wouldn't even necessarily need to be going to someone's office if that's a stressor as well. Sometimes makes it a little easier, especially if you've got a newborn at home.
Absolutely. So speaking of the mental health and emotional health, this question is for Dr. Clayton. Lots of parents would normally bring their little ones to daycare or grocery shopping, all those places where they might get some socialization, but they are reducing doing that because they want to reduce the risk of contracting COVID-19. Does this isolation have an impact on child development and social skills?
Yeah, it's a super broad topic that doesn't have a lot of historical research because we've never really been in situations like this before. We know that infants and toddler development are largely dependent on their caregiver and the caregiver's interactions. So social isolation isn't going to be as an important component during that period of time. However, caregivers' mental health, like you guys were speaking about before, can definitely become an issue if they are overstressed or over anxious or depressed and withdrawn. Then that could certainly have an impact on a baby or infant, toddler, their development. We also know that play is really important to not only social interactions, but also the physical development of the brain. So when children have been isolated from their peers or from their social groups in schools, that's bound to have had some impact on their development and their mental well-being. We also know that prolonged isolation can increase the risk of anxiety and depression in children. And that adverse childhood experiences can lead to long-standing effects on children's health and mental wellness. But I like to think that children are really resilient, and we're going to start getting this pandemic under control as more people get vaccinated. We get more back to a normal schedule, a normal level of interaction, and I'm very hopeful that that we won't see long-standing changes in these areas. And I think it's really important to know and remember that healthy childhood development is also dependent on a lot of things that we have control over. So healthy pregnancies, breastfeeding, a supportive and positive family life, good sleep, healthy diet. So a lot of those things we can control and can help counterbalance the negative impact that the last year and a half has had.
Mm-hmm. Yeah, when you mention the importance of play and development, it makes me think back to the time when city parks were closed and you couldn't use them, and how grateful I am now to be at this stage where those are open and we can safely use them with social distancing. And my kids are grateful, and so am I. So you touched on this a little bit, Dr. Clayton, and I know we'll be talking about it on Friday with Dr. Truman and Dr. Price, but I wanted to touch on the stress that has been brought to many households. And with that heightened tension, do you see increases in things like child abuse and neglect? And specifically, what can parents do to prevent that from happening?
Yeah, anecdotally, I feel like our group has seen a small increase in the number of cases we've, unfortunately had to take care of in the hospital. I think the national data available is not very accurate and reliable because in general, people are, during the height of the pandemic, were seeking care less often.
Mm-hmm.
And so they weren't necessarily bringing their kids in for broken bones or, excessive fussiness and other things that they might otherwise would have. Plus, children aren't in school or in daycare, so you don't have those required reporters interacting with children and catching those cases of abuse and neglect. So I think the number of cases is probably underreported, but we have to think that given the amount of stress that people are under, that there likely has been an increase in the number of cases. So I think some things that parents can do is taking care of themselves, making sure they get enough sleep and rest, finding positive outlets for their stress, eating a good healthy diet and getting exercise to allow release of some of those levels of stress. Something that I think is really helpful, especially when you have younger children, including babies, is if you start to get really frustrated and you can feel your tension building, to put your child in a safe place in your home and walk away. As long as they're somewhere safe, give yourself some time to cool down and come back with a fresh outlook and a lowered level of stress. And I think that can be really important. And then just remember, despite the social distancing and isolation, try to maintain your support systems so that you have people you can reach out to if you need, to get away a little bit. If your family is capable of helping you care for your children. And then talking with your doctor or your children's doctors about ways to manage stress and other resources that are available to help in those situations.
Absolutely. That's my favorite piece of mothering advice that was given, was to put a fed, changed baby in a safe place and go walk around, especially like Darcy mentioned, going outside has some magic in it that can kind of dissipate those anxious feelings. Dr. Clayton, I've got 2 older kiddos, and they are sometimes anxious and scared during this time, during the pandemic. What advice do you have for explaining to them what's going on and helping them cope?
I think something that is especially important as our work-life balance schedules have changed is to try to maintain a routine. So waking up at a reasonable time during the day, having periods of exercise, healthy interaction with your children, making sure to eat a healthy diet, having a routine bedtime procedure so that kids get plenty of sleep. All of those things, I think, go a long way to helping maintain normalcy in children's lives. And I think, children play off of our emotions a lot. So as much as we can manage our levels of anxiety and stress, that will go a long way to helping them do that as well. And then when you do recognize symptoms of stress and worry in your children, speaking openly with them about it, listening to how they feel and where those feelings are coming from, and then trying to, teach them that things won't always be this way, and start looking towards the future and, make plans for when a time is that we're going to be able to do things a little bit more normally.
Yeah, good idea.
I think the we as providers have seen, at least I've seen, that the fear and uncertainty and stress, I've seen a decrease in that this year compared to last year. I've seen a decrease in it in even the staff at the hospital now that they're vaccinated. They are less stressed about, even like you were saying, Amy, them being okay with you taking your mask off while you're pushing, and we as providers, we don't want a patient to have to wear a mask while they're pushing. I mean, that's awful, so I mean, but now that we're vaccinated as providers, our anxiety has gone, at least mine has, tremendously. My anxiety as a provider and taking care of patients has gone down. And I think there is a little less fear, for women getting pregnant again and breastfeeding and less fear about coming to the doctor. I have patients coming back to see me and haven't been to see us since before the pandemic because of that fear and uncertainty. And they're coming back, and people are coming back to be seen again. Even non-pregnant patients, coming to the doctor for the first time during this, and that we as providers hope that fear and uncertainty and stress that we hope as more people get vaccinated, and as we learn more and we have less of our control, and as we're more knowledgeable, that we as providers can be less stressed, and so hopefully our patients and mothers and everybody.
I can imagine as providers, it's a lot more reassuring when your patient says, is this something I'm at risk for? Or how does this affect breastfeeding? That you have like real data that you can point to now. And before it was very, we don't know, we're waiting to see. Speaking of data, Dr. Clayton, is there any evidence that would point us to vaccines with kids, and how much do we know right now with COVID vaccines and their readiness for pediatric patients?
Well, the FDA has authorized the Pfizer vaccine for 16 years and older, and that's been, pretty much since the beginning of the big vaccine rollout. And the AAP strongly recommends that children 16 and older become vaccinated. There is now pending authorization for 12 and older with the Pfizer vaccine that people anticipate will come out relatively soon. And again, the side effects that we're seeing with the vaccine in children are very similar to that in adults. Fever, pain where they put the needle in your arm, maybe redness and swelling at the injection site as well. So there are a lot of the same side effects we see with other vaccines that are available. And I think that it'll be important for children and their parents to consider for them to be vaccinated, because as of recently, about 25% of the new cases of COVID have been in children. And so while children seem to get sick less often, there still have been about 200 deaths since it started from COVID. So it's not insignificant. And we know that there are kind of long-lasting side effects of infection in some children with the long haulers and the MIS-C inflammatory cases. So it's not a completely benign infection in children. And so I think it is important for parents to consider vaccination when it's available. And I just encourage parents to talk with their kiddos' providers and have a discussion about it, particularly, if they're considered high risk. And hopefully they feel comfortable talking with them about the risks and benefits for vaccination.
And remember, the Pfizer's at 16, but the Moderna and the Johnson is 18. They are not the same.
Yes.
And Johnson is only one shot, the other two are 2 shots. But apparently immunity is as early as 2 weeks after that second shot. So it's pretty quick once you get it. I will point out that for my patients, if they're pregnant and they're wanting to get the vaccine, I do discourage the Johnson & Johnson just because of the few cases of hypercoagulability and low platelet counts associated with, very rare, but still there among women. And we women pregnant already have risks related to that. So I sort of pushed the Moderna or the Pfizer and discouraged the Johnson & Johnson. And I do say, even though these vaccines are not going to be genetically involved with our system, they don't get into our DNA, many of the patients are kind of delaying to their first trimester. I'm not sure there's really validity in telling them to delay their first trimester, but some of them do. I encourage it at any point, whether they're trying to get pregnant or are pregnant. Maybe they feel a little safer if it's not in the first trimester, but no data to discourage it from getting it in the first trimester. I just would be reserved about the Johnson & Johnson at this point.
You just read my mind. I was just about to ask you for timing and when in pregnancy you would recommend being vaccinated. So you would say at any stage, if you're nervous, you could wait until the second trimester, but anytime.
Yes, and I discourage them from being nervous about it, but you know, whatever. And I'm a good mind reader.
Also for women that are considering pregnancy, that are not pregnant yet, this is a great time to do it. Even if you're actively trying or were to actively conceive while you're in the middle of the series, you the second shot, you'd go ahead and move forward with your second shot. There's no evidence that it contributes to miscarriage or infertility.
And that's exactly what I was about to say. I think the infertility myth it's completely made up, but I just wanted to explain why and where that came from. There is a spike protein that exists that helps the placenta attach. And so people heard spike protein antibodies, which is what you get from the COVID vaccine, and thought that maybe there was some correlation with the spike protein involved in getting the placenta attached, and they're completely different things. They have nothing to do with each other. It's just the fact that they used some of the same words. So scientifically, there's absolutely no basis to concerns about infertility. And in fact, being really, 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 really sick with anything at all is not good for your fertility. And so, protecting yourself against illness is always helpful for fertility.
Absolutely. This is one of our questions from the audience. We were talking about vaccination and having our guests for meeting a new baby be vaccinated. Dr. Clayton, can you address how would you navigate kids that are not able to get vaccinated yet? So kids like under 10, obviously under 16 is what's currently not able to be vaccinated, and they're working on younger children, but would it be okay for them to be around baby?
Yeah, I think a lot of it depends on people's personal preference and personal level of security. But I think the things that we can do to prevent babies from getting infection are good hand washing, visitors wearing masks, because we know those prevent the spread of infectious organisms. And then obviously, if your visitors are sick or been around someone who's been sick recently, postponing that visit until later. All of those things can be done for children over 2. Children over 2 can wear masks safely. And so those are the things parents can do outside of the availability of the vaccine.
I've been really impressed with how willing my older kiddos, they're 7 and 9, were to wear a mask around the baby, and they're really diligent about it. I think she's so cute that it's easy to get them to do anything. So I think we might have touched on this, but I wanted to toss a question to Dr. White. When will things go back to normal? Question asker says, as in visitors when baby's born and more than one person in the delivery room. When do you see that starting to happen?
That's the hardest question you've asked me so far.
You don't have a crystal ball?
Yes, when we all like a crystal ball, right? I think, I hope at some point that as more people get vaccinated, that things will start opening up more for vaccinated visitors or vaccinated people to come be present in the delivery or have an extra visitor if they have a vaccine card. I'm even just making that up. I don't even know if that's a thought process, but a consideration. At this point, there's nothing that I have seen coming out from our hospital and or any other medical facilities. I know States are opening up, restaurants are opening up. In the medical community, that's not happening at this point that I know of. Right now, we are allowing in our office for our obstetric patients, one visitor, masked visitor that doesn't have any symptoms or exposure. And that's the same policy that TMH is using during the labor and delivery and postpartum and recovery. Minors are still not allowed in the office and or in the hospital. You can have your children come to visit your newborn in the hospital at this point. And I don't see any, or I haven't heard any thoughts of that changing anytime soon until I hope that as more people are getting vaccinated, that will encourage the change, and that we hope to be able to change that. I mean, we, even as providers, don't like telling our patients when they're coming for visits or labor, if they want their mother and their husband at their delivery, that they have to pick one or the other. It's hard for us too. So we can't wait until we can, have more flexibility for that, for support for our patients. And so, but unless anybody else knows of a secret that I don't know, but I haven't heard any evidence of that changing anytime soon in healthcare, despite that it seems to be opening up in the communities and restaurants and these types of things.
I know I'll give a reassuring word to those who they wanted to have their kids come and meet the brand new baby in the hospital. That was the thing for my pregnancy and birth experience that I mourned the most. I really wanted to have that moment. So it's doable to have a lovely, wonderful meeting of the brand new baby outside of the hospital doors. And in your experience, you won't even miss the hospital for it. But I do know how hard that is. So this one will be our last question. What if a mom in labor discovers she has COVID-19? Will she then be separated from her baby?
Yeah.
Not that I'm aware of, no. I mean, if she has COVID, she'll wear a mask. That would be ideal. She'll still breastfeed. So no, I'm hand washing, whatever. And Dr. Clayton, correct me if I'm wrong, but the point of it is that they are still together as much as possible with all the safety things you would do if you were exposed to any other COVID patient. I mean, they're going to wash hands, they're going to wear their mask, definitely encourage breastfeeding. But the bonding is very important, and that is supported.
Yes, the several patients that we've had to deliver with COVID, luckily, Dr. Forsthoefel and I haven't had any active COVID pregnant deliveries this year. All of ours
were last year. Okay.
2020, yeah. So we've been very fortunate so far this year in 21 that we haven't had any deliveries with COVID actively positive patients, which has been wonderful. But last year we had several, and all of our mothers were not separated from their babies. They chose breastfeeding, they chose rooming in, they chose mask wearing, and they all did, and all the newborns did great.
Awesome.
Yeah, early on we were testing newborns at certain points postpartum to see if they contracted the virus during that point in time. And all of the ones that I have heard of tested negative. As Dr. Forsthoefel mentioned earlier, there are case reports of babies acquiring COVID peripartum. We don't, most likely postpartum and not vertical transmission or transmission through the placenta. But yeah, as a newborn provider here, we encourage moms to continue breastfeeding and would never require them to be separated from their baby.
That's really reassuring. That was definitely something I heard rumors of while I was pregnant. And I was reassured to learn in prenatal visits that was not going to be the case, because rooming in is great. Anyone have any final thoughts to add?
No,
We know a lot more now, so
live not in fear.
all right. Well, that brings us to the end of our time today. Thank you all so much for your time and insight. And thank you to everyone who tuned in for this discussion. I hope you join us for the remainder of our Baby and Family Virtual Fair speaker series. Our next webinar is tomorrow, Wednesday, May 5th at 4:30 p.m. And I will be joining you again to cover the topic of unmedicated childbirth. To see our full lineup and to register, visit tmh.org/fair. Have a great weekend.
Thank you.
Bye, y'all.